Hi, Sexy. Thank you so much for joining me again today. I'm Dr. Limor, your family, sex, and relationship counselor and therapist. This is Anti-Aging Sensuality. And today I want to talk about a very interesting topic, as always, that was very interesting to me on a personal level because if you guys know me and follow my content and or friends of mine, usually, I'm sure you've heard about my chronic condition. I suffer from chronic migraines. And so to me, the topic today is very relevant, both on a personal level and of course on a professional level. And the topic today has to do obviously with chronic pain and intimacy, or chronic conditions and intimacy. How does it influence? How does one influence the other? And does it impact our ability to deal with intimacy, to function as an intimate partner, and all of the above? So I went and investigated, and I found a few very interesting studies, and I want to bring two of them because they are kind of a testament to the differences between genders as well when it comes to intimacy. I'll get right to it. So the first study that I want to share with you covered 58 men and men that are married, and they were suffering from chronic pain or a chronic condition, essentially chronic pain. And the study was examining how did their partners, the female partners, these were heterosexual couples. So the study was examining how did the wives of the men that were suffering from chronic pain, how did they function in light of this difficulty. And the results are very interesting. The results show that women that are married to men that suffer from chronic pain or a chronic condition usually attest to a very low marital satisfaction, very high depression. All the women were attesting to it in this sample, in the study. And moreover, in comparison to this male, the partners that were the sufferers, the pain sufferers themselves, the women were attesting to a higher depression rate and a lower marital satisfaction. So essentially, the people that were suffering were unhappy less than the people that were partnered with the suffering person. That's interesting. Rolling over to the new study that I want to share with you, this study examined 3 groups. 2 of them were study groups, and the third one was a control group. And so the study group, first study group had to do with 20 women. They were suffering from chronic pain and their partners. The second study group had to do with a group of women that were suffering from diabetes. So chronic condition, not necessarily pain, but condition, sometimes pain as well, but essentially a condition that is chronic, and their partners. And the control group, of course, had 20 couples. They were free of pain, praise the Lord. I'm very envious. But essentially these groups were compared in, and I want to specify exactly what they were examining. So there were 4 questionnaires that were given to these study groups and the control group, of course. And the 4 questionnaires covered this: marital satisfaction, mood, chronic condition self-implication, how this chronic condition self-implicated the person suffering himself. Thank you, Lola. And the coping modalities that the person suffering, both the person suffering and their partners, what kind of coping modalities they dealt with. And everything was assessed to examine both depression and marital satisfaction. The results were very interesting. So first result that is significant and I want to share with you was that the group of the diabetics, the women that suffered from diabetes and the women that were suffering from chronic pain were showing the same kind of depression level and low marital satisfaction between the groups. In other words, it doesn't matter if it's a pain that is chronic or condition that is chronic, that is not necessarily painful, but these things really impact women when it comes to their ability to be satisfied and to be non-depressed and to be happy, essentially. So these two groups showed about the same kind of level of depression and marital satisfaction that was low. But what I found very interesting is that within both groups, the levels of depression and the level of marital satisfaction was by far was kind of similar between the partners and their wives. In this case, the wives were the pain sufferers. So in other words, I want to say that when it comes to being a partner of someone that suffers or being the person that suffers really depends on what gender you are. Because when we looked at a study where the pain sufferers were men, the women were showing a lot more depression and they were a lot less satisfied with the relationship. But when we see that the woman is the one that is suffering, the partner is kind of more malleable and more coping and more adjustable to the pain and shows quite the same kind of dissatisfaction with the marriage, but not more in comparison to the women that were showing a lot more in the study that had to do with male pain sufferers. So this kind of solidifies the idea that men are better than women. I'm joking, of course, but this is a very interesting point to make, and hopefully this kind of sheds light on the idea or the topic of chronic pain or chronic condition and how it impacts our intimacy. Obviously, it's something that can be adjusted and we can work around it, but it does obviously impact our relationship and our ability to be intimate. And there are many factors to these studies that I don't want to impose on you with this. I just wanted to bring this specific point that I made. And hopefully this kind of sheds light on our ability to understand our partner and to kind of relate to them if they are pain sufferers and if we are supposed to be a support system for them. Hopefully this sheds light. Thank you so much, and stay sexy and subscribe as I always ask you, and come visit me again soon. I'll see you again soon. Bye-bye.